Frustrated that your knee replacement recovery isn't going as smoothly as promised? Well, in my 28 years of experience as a physical therapist, I've seen this story countless times. You were told you would be walking normally within just a few weeks, and now here it is several weeks later, and you still feel like you're struggling. So let me explain what's really going on and how I can help you get back on track. So in actuality, a lot of times when you go in and you talk to your surgeon, they say, oh yeah, you'll be walking fine, no problem. Well, you start to create this narrative in your head that walking fine, no problem, may mean within a couple of days, within a couple of weeks. Maybe you've seen someone at work, at church, out in public, and they've had the knee replacement pretty soon, or not too long out, and they seem to be walking pretty good. And so you make that assumption. But in actuality, we're all individuals. And so that time frame to kind of walk normal or walk without your walker is going to vary, but normally anywhere from kind of the 2 to 4 week time frame, that's pretty normal. Okay, so don't get in too much of a rush if you're 3 days out after surgery and still feel the need to use the walker. Also, as we age, which is majority of the population getting a knee replacement, you're also dealing with weakness. You're dealing with balance issues, maybe some other mobility issues that you developed through the years from other injuries or other surgeries. And so you're not a spring chicken anymore getting a new knee. That usually takes a little bit more time to kind of work through. And also the stiffness. After a knee replacement, that's very painful. That and a rotator cuff repair are probably the two most painful procedures that we have to help patients recover from. And so that stiffness, the pain after a surgery, the swelling, all those things compound the recovery aspect. And then you throw in, if you've got other medically related issues, you're diabetic, you got high blood pressure, you got cholesterol issues, you haven't been very active, you're not very healthy, all of those also make the recovery process a lot harder. So in this video, I'm going to give you some honest answers about that and a couple practical solutions you can use to help take your recovery to the next level. Although average recovery time frame is in kind of the 2 to 4 month time frame, we walk patients through the magical 5 phases of healing that I developed to help patients get a clear understanding of where they are in this recovery process. Early on, you're in phases 1 and 2, and we'll link to that video as well, so you can check that out. So early on in phases 1 and 2, it's all about getting the pain and inflammation under control, while we're also working on your mobility, your flexibility, your strength, and working to get you off that walker. So as you move into phase 3, which is kind of some returning to normal daily activities, you're off the walker, maybe you're using a cane or nothing at all, and you're feeling fairly confident. Full recovery can take up to a full year. So most patients are shocked when I tell them 9 to 12 months recovery, because they said the surgeon's said I'm going to be doing fine in a couple of weeks. Well, fine is your pain is under control, your swelling's under control, and you're up and walking about. But that's not functional. So therapists are going to look at you from a functional standpoint. The surgeon is looking at, did that knee go in there properly? Is everything balanced? Is everything aligned like it should be? Therapists are looking at you from a different holistic functional status. Also, as you're older, you'll have developed sarcopenia. That's just a natural muscle loss. And over time, that just continues to compound unless you're actively involved in some strength training type exercises. You may also have some pre-existing balance conditions that are going on. I mentioned multiple health conditions, and then also some inflammatory responses, whether that's rheumatoid arthritis or just from eating habits that can create more inflammation within the body. The balance is a tricky situation because a lot of times leading into that knee replacement, your balance is already off. Maybe you're using a cane or a walker. And what happens is, as you become more dependent on that cane or that walker, the body is challenged less, so it continues to lose strength. We mentioned that sarcopenia, which is the natural process, but it also starts to throw off your balance because you're relying more and more on that walker or on that cane leading into that knee surgery. And then also other aging factors we have to deal with is our reaction time is slower, right? As we're walking, it's harder for us to step over the cat or step over that object that fell in front of us. So that may lead to tripping or balance issues. Our visual changes, and you may potentially have some neuropathy in your feet. So that altered sensation in your feet is also going to disturb how you're interpreting where your feet are on the ground, and which can also affect your balance and your gait. The other confounding issue is the quadricep damage from surgery and also the use of the tourniquet. And the swelling that is involved with that shuts down that quad. So in some patients, it's a real challenge to get that quadricep to fire and to work better. So early on exercises, right? So we want to start with some early aggressive quad strengthening. Initially, it's just going to be doing some quad sets to pump the blood and to get that muscle to turn on. We can progress that into a straight leg raise, which is really going to challenge the quadricep and hip strength. Balance training. Initially, it's just some weight shifts to get some pressure over onto that knee to get your body to start to accept that new knee and also the pressure in it to get that quad to fire. And then we start to progress into walking drills, heel toe walking, side to side, anything to kind of get you up moving, but also challenge that balance just a little bit, all while being safe. The other key is really managing the swelling. So early on, lots of ice, lots of elevation to help control that swelling. When you get the swelling under control, that's going to allow that quad to fire and work a little bit better. Make sure your foot is up above the level of your heart. Too many times people say, yeah, I elevate my foot. I lay in the recliner. Well, if your knee is below the level of your heart, the fluid is not going to pump uphill. So you have to think about if you poured water onto your knee and you're laying down with your leg elevated, is that water going to run downhill towards the groin, towards the heart? That's what you need to do when you say elevation. Most people do not get that leg up elevated high enough. You can also use compression garments. We use normal recovery compression boots in the clinic, but sometimes the surgeons are sending them home with little calf compression devices. You can wear compression socks as well. The other is about every 2 hours, you want to make sure you're up moving around doing something. So if your therapist is giving you exercises, every couple hours, get up, move around, practice those exercises. If you miss it because you took a nap or you're on pain meds and you can't do them for a little bit, that's fine. But just try to get on that cycle where you're constantly moving and doing some type of activity, but also listen to the knee and don't push it too hard. So there's a balance there. And then also addressing any underlying weaknesses and or mobility issues. So frequently, as I said, people are coming in, they've already got some stiffness, maybe in the hips and the ankles, they've got some hip weakness. That's all going to affect what happens at the knee joint. So as I said, we look at you holistically and we incorporate that into your program, whether it's strengthening mobility for the hips and ankles, as well as the knee, and the core gets a lot of work because a lot of people are coming in, they've got underlying back issues. They start to move after the knee surgery. They're on the walker, they're on the cane. Guess what? It starts to flare up the back. So we end up kind of treating the back sometimes after a knee replacement as well. Some signs you definitely want to make sure you're paying attention to is you're not making the progress that you should. So you should be progressively getting better in terms of your range of motion, whether it's extension to get your knee straight or your flexion to make the knee bend. You're staying consistently swollen, a lot of hot redness around the joint. You're not able to progress. Those are signs that there may be some joint infection or something else wrong. So definitely contact your healthcare provider and your surgeon about that. And also watch out for getting off your walker too quick. I see a lot of people that are really gung-ho because the doctor said, yeah, you'll be walking fine. They try to ditch the walker too early. Then they develop some compensatory gait mechanisms. They start walking funny. And guess what? Now it flares up that back. Now it flares up the hip. So you want to just pay attention to that. We want you off soon, but not too soon. All right. So overall, remember your recovery and the progression at times is going to feel slow and it's not linear. So it's peaks and valleys. So just get used to that. Again, don't compare yourself to other people that you know or you've seen. Even if you've had the other knee done, I've seen this a lot. It's like kids. No two kids are alike. So you get the left one done. Maybe you sail through therapy. You're doing great. You get the right one done. Whole new ball game. Okay. So again, you have to not compare left to right or for you to somebody else. You just have to take what you've given at the time and work through those problems. Also, those small improvements are going to compound over time. So consistency is the key, right? So that's why I said every couple hours you're doing an exercise, you're practicing something. So you're very consistent with your exercises. And that will lead you down the path where you'll eventually do really well after your knee replacement and you'll be very happy that you did it. So if you like this content, please like, subscribe, hit the notification bell, whatever the things you've got to do. Also, down below, comment how far out are you after your knee replacement? And if you've had a knee replacement, what was maybe one of the biggest challenges you had to overcome? So thanks. Hope you guys have a blessed day and stay safe. Hi, this is Dr. Robert Moss. If you're looking for a solution to help improve your balance, your strength, and remain independent, then I have an in-home balance program course that'll be perfect for you. Just check the description below.